everybody, my name is Gabrielle Traub, and I'm going to be sharing to you today how to treat thyroid conditions with homeopathy. A little bit about my background. I'm a South African trained homeopath, and after graduating from South Africa and working there for a few years, I practiced in London and eventually ended up in the United States. I practice in California now. I worked in a traditional OBGYN clinic for over a decade with a traditional OBGYN and fertility endocrinologist. I also worked in an inpatient treatment center where I was part of the core treatment team of doctors, it was inpatient for eating disorders, chronic pain, addictions, and PTSD. My practice today is comprised mostly of women and children. I treat a lot of women and kiddos. And I also spent a year doing homeopathic research, conducting double-blind clinical trials on homeopathic remedies for thought interference, nervous system anxiety, so difficulty with focusing and concentration. But today, the topic is really, really important. We have entered an epidemic proportion level of thyroid disease. There are over 20 million Americans with thyroid disease, and over 60% are undiagnosed. It is much more common in women. In fact, almost 1 in 8 women will at some point in their life suffer from some kind of thyroid disease. And the thyroid disorders that are most commonly talked about are hypothyroidism, which is an underactive thyroid, a slow metabolism. We have hyperthyroidism, which is an overactive thyroid. We also have Hashimoto's thyroiditis, which is an inflammation of the thyroid gland that eventually settles into a state of hypothyroidism. And Graves' disease, also an autoimmune condition, which presents as a hyperthyroid condition. So when we're treating autoimmune diseases, we take a slightly different approach from a medical perspective. From a homeopathic perspective, however, it doesn't matter what the diagnosis is because we are treating the individual, treating the patient. Some people develop thyroid nodules for various reasons, either because it's the thyroid's way of compensating from an underactive thyroid. They produce excess thyroid tissue in the form of nodules. Some medications and other conditions can also cause it. Thyroid cancer and myxedema, which is very rare, but is a severe form of hypothyroidism, which is life-threatening. So what causes thyroid disease? Why are we seeing so much thyroid disease? What is the root cause? And so there's a few different reasons. The most common and the most easy to treat form of hypothyroidism is iodine deficiency. And this is actually so easy to treat. You just give them a good source of iodine, and that will correct the iodine deficiency. So that's the most simple form of hypothyroidism to treat, just a lack of iodine, and the iodine is necessary to produce the thyroid hormones. This is very rare today in modern United States. They try to add iodine to table salt to try to correct that, and that certainly takes care of the lack of iodine, but it's not a very good form of iodine. So we try to encourage patients to, instead of using iodized salt, to try to get iodine from more natural sources and have sea salt instead, or Celtic salt, or Himalayan pink salt, or there's so many different forms of salt with different benefits. There's something called the Wolff-Chaikoff effect, which is that excess iodine can also be a problem. So there's kind of this Goldilocks zone in which you want your iodine levels to be, and that is something that is measurable. You can do blood tests to determine that. Autoimmune, which is in the hypothyroidism, Hashimoto's, this has become increasingly more common. Why is it that our body is attacking our own thyroid? We want to really look into the reasons behind that. Occasionally, we can have congenital hypothyroidism. Genetics certainly play a role. Infection can cause it, certain medications. Obviously, after post-thyroid surgery or radiation, if somebody has their thyroid removed, this is usually in a state of hyperthyroidism. They'll have treatment for that, and then they'll need to be on thyroid medication for the rest of their life because the iatrogenic intervention actually pushes them into a hypothyroid state. It could be due to pituitary or hypothalamus disorders. We see a lot of thyroid conditions come on due to hormonal changes, specifically during pregnancy and postpartum, but we can also see them during menopause and perimenopause as well. I want to highlight the connection between the thyroid and the adrenals and how the adrenals and the thyroid are intricately connected. And when you treat the thyroid, you often need to treat the adrenals as well. Luckily, with homeopathy, we're treating the whole person, so we're naturally doing that. So let's look at why is there a connection and how did this evolve? So from an evolutionary perspective, when the caveman or was hunting or chased by a tiger, or if there wasn't enough food around, food was scarce, what would happen is they would have an adrenaline response and releasing the sympathetic nervous system would engage, and the hormones produced by adrenal glands would actually temper and slow down our thyroid for a very specific reason. We did that so that we would stay alive. So if there wasn't enough food around, our bodies would start to need less food to survive. Or if we had to be on the run, running from a tiger or a lion, we couldn't stop and eat and digest. We had to keep going. And so for this very reason, this actually genetically, these adaptations helped us to survive. And people who had this genetic adaptation to be able to preserve their metabolism for longer periods of time would actually outlive those who couldn't do that. So this evolved as an adaptation to be able to survive during hardship, during times of famine, or during times of starvation. However, our body cannot detect the difference between a tiger chasing us and our boss, shouting at us. So when we have this adrenal stress response, our thyroid naturally slows down. So this is the correlation between the stress and our thyroid. Stress has effect in two ways in a person's metabolism. Sometimes people lose weight when they're stressed, and usually because they're not eating properly. But many times that stress causes us to increase our cortisol levels, and cortisol is like prednisone. If you take prednisone, you'll start to put on weight. So this cortisol will actually inhibit thyroid function and slow our thyroid down. And it's very important that the body does this as a way to protect ourselves. It doesn't hate us. It's not trying to make us put on weight. It's doing that to preserve life. So we have to approach this with reverence and respect and thank the body for trying to save our life and not let us die. But at the same time, we have to find ways to mitigate this, to moderate our stress response, whether it's through stress management, whether it's through lifestyle, meditation. We have to rein the stress response in. And so we could either do this with homeopathy, which is amazing and modulating our stress response, or sometimes we may need to add in some adaptogenic herbs, or really lifestyle is, reducing our response to stress is going to be the most effective tool. Similarly, many of you may find that if you stay up too late or work the graveyard shift, you'll start to put on weight. That will also in turn slow down our metabolism, slow down our thyroid. And we'll talk about that in a little bit, why that happens. There are a few factors that inhibit proper production of thyroid hormone. Stress, we talked about. Infection can do that. Trauma, radiation. This is why it's so important to have your iodine stores rich, especially if you're exposed to radioactive iodine. It's amazing. If you are low in iodine, your body will actually absorb that radioactive iodine if you're hungry for it, if you're starving for it, and that can start damaging your thyroid. And when you're walking around the supermarket, you don't know if somebody's just had thyroid radiation treatment that irradiated their thyroid. You don't know that. So it's very important to keep our iodine levels in that Goldilocks zone. Certain medications can inhibit proper thyroid functioning. Fluoride can do it. In fact, fluoride and iodine are both halogens, and they work antagonistically to each other because they compete for the same receptor sites. So if you have excess fluoride or fluoridosis, that can actually impede your iodine absorption, and that can make your body not produce the correct amount of thyroid hormones. Toxins such as pesticides, heavy metals, and autoimmune disease will impede production of proper thyroid hormones. And then there's certain factors that increase conversion of T4 to reverse T3. We don't want, so reverse T3 is so our thyroid releases different hormones. The TSH, which is actually not released by the thyroid at all, that's released by the pituitary gland. And that's released to stimulate the thyroid to release its hormones, which are essentially, the most importantly, T3, T4, T7, and so forth. But reverse T3 and T3 compete for binding sites. So T3 is the active form of thyroid hormone. That's the stuff that your cells can actually use. Reverse T3 is a reserved form, and that's not active. And so we really want our thyroid hormones to be accessible, to be able to be absorbed by our cells so they can be utilized effectively. So factors that increase conversion of T4 to reverse T3, which is the inactive form, are things like stress, trauma, surgery, malnutrition, a very low-calorie diet, inflammation, having that cytokine storm, toxins, infections, medications, liver or kidney disease. These are all factors that can, you may still have enough TSH or enough thyroid hormone, but they're not in the form that your body can utilize it. And that's why a lot of naturopathic doctors and functional medicine doctors will do very comprehensive thyroid testing to be able to have a better understanding of exactly what's going on. By measuring your TSH alone, that doesn't really give you enough of the picture. So what are some symptoms of hypothyroidism and hyperthyroidism? So hypothyroidism is an underactive thyroid, whereas hyperthyroidism is where your thyroid is too active. And we always want to be in a very narrow range of what is going to be the ideal thyroid function for your bodies on a cellular level. In both hyper and hypo, they have a hair loss. In hypo, there's more dry hair. In hypothyroidism, there's puffy face, there's periorbital swelling around the eyes, there's a lot of edema and weight gain. Both can have a goiter. In hyperthyroid, we see something called exophthalmos, which is the bulging of the eyes. Hypo will have a slow heartbeat, where hyper can have rapid heartbeat and palpitations. Hypo, we often see weight gain. In hyper, we often see weight loss. However, be very quick to judge. If you have a skinny patient who's not overweight, they can still have hypothyroidism. In fact, in many of the patients I treated for anorexia nervosa, bulimia, like all the types of eating disorders, many of them were hypothyroid because they had messed up their metabolism so much from extreme dieting, and they were very thin. So you can still have hypothyroidism and be skinny. And hypothyroidism tends to be cold, chilly, and sensitive to cold, whereas hyper tends to be hot and heat intolerant. Hypothyroidism tends to err more on the side of constipation, where hyperthyroidism has diarrhea. Both cause changes and dysregulation of the menstrual cycle. But with hypothyroidism, that's a very common cause actually of miscarriage and infertility. So if you're working with women's health conditions, you always want to rule out, is there a thyroid condition? Because that can cause a lot of change in the menstrual cycle and also their fertility. Understanding thyroid labs and the optimal ranges. So the most common thyroid marker that we look at, as I mentioned, is TSH, that's thyroid stimulating hormone. And that is actually a hormone of the pituitary gland, but that is a hormone that tells the thyroid how much of its hormones to produce. So that's a thyroid stimulating hormone. So it stimulates the thyroid to release its hormones. So we have a normal range. And then in functional medicine and naturopathic medicine, they often look at an optimal range, which is usually more narrow. So sometimes you can have subclinical hypothyroidism where all the labs are kind of in the normal range, yet patients are still symptomatic. However, we want to be very careful about over-medicating, because the thyroid hormone works on a system of negative feedback loops. So if your body is receiving extraneous thyroid hormone in the form of thyroid hormone replacement therapy, it will actually inhibit its own productions of thyroid hormones. We have to be very clever and intentional, and make sure that your body really does need that thyroid hormone. Or many of the times patients opt for homeopathy, where we don't have to worry about that. Then we have your total T4 or TD4. A lot of these additional hormones like FTI, that's the thyroid binding capacity for T4, really tells us about is the thyroid hormones bound or unbound? Can they be carried into the cells properly? Can they be transported into the cells? Are they free, or are they in their stored form? Are they in like an active form, or are they inaccessible? When we look at T3 and T4, if a patient has more T3 or less T4, that can be a determining factor of which bioidentical thyroid replacement hormone to use. For example, Armathyroid has more T4, whereas Nature Thyroid has more T3, and so forth. These types of things are not as relevant from a homeopathic perspective, but it is good to see trends and to see with the homeopathic treatment that your patients are moving in the right direction. I like having a baseline. Many times when a patient starts homeopathic treatment, their thyroid needs will actually decrease. And so at that point, it may be appropriate under the care of their doctor, their team. It's very important to always do it under supervision of their doctor who's prescribing the thyroid medication, but they can sometimes need less medication and potentially eventually be able to come off medication completely. But this has to be done very, very carefully. It can be very dangerous to just stop thyroid medication suddenly. If your body's not used to it and doesn't have its own enough thyroid hormones being produced, this can cause a lot of problems. The other thing that we look at is our thyroid antibodies, TPO or thyroid peroxidase. And this number should be under 15. Otherwise, there is an autoimmune component going on, which means that the body is attacking its own thyroid. So this just gives us kind of a broader picture. As I mentioned before, this is more helpful from a naturopathic or functional medicine perspective if they're planning on using hormone replacement therapy. If you're using it from a homeopathic perspective, it's still nice to have, because I like to monitor. It gives us an idea of if the patient's improving or not. Sometimes a patient can have hypothyroidism and is asymptomatic. And it's nice to be able to have measurable ways of seeing if the remedy is helping or not. For me, it's more important how the person feels than what their labs look like. It's just an added piece of information. It's an additional tool. One thing that a lot of clinicians are not aware of, and this is really, really important, is that scientists have found, and I've seen this in my own practice, that there are natural seasonal rhythms in TSH, and that just like most animals in nature, many animals go into a state of hibernation. We don't hibernate as humans, but our metabolism does become more sluggish in the wintertime. And not for all of us. Honestly, it depends on where you live, the climate that you live in. And so there's such interesting research. I actually provided some links to share with you. You can go take a look at these links. It's really, really interesting. What they found is that the amount of what we call photoperiodism, in other words, when the light hits our retina, that actually, our brain detects, our pineal gland detects the length of daylight every day. And this will actually determine how much thyroid hormone we produce. This will affect our circadian clock. It's integrated with melatonin. I mean, it's really fascinating how levels change. And so it's expected that many people will have fluctuations in their TSH. Now, that doesn't mean to say that we need to over-medicate them with thyroid hormone. This is a normal and healthy fluctuation. This is how it's supposed to be. So many times doctors are not aware of these normal fluctuations. And when they see the TSH going up, they'll add in more thyroid hormone. And this is something that they really shouldn't do. Many doctors are not aware of these natural seasonal rhythms. But it's also important to remember that if you're working the graveyard shift and don't see any sunlight, and if you are always going outside with your sunglasses on and never getting actual light, or you never go outside at all, then your thyroid is not being triggered by these natural circadian rhythms. So if you want to have a healthy thyroid, it's important to get outside. They say the morning light is really important, but it's actually the duration of light. So if you're always in a cubicle where you never see light all day long, it's going to be very difficult to treat your thyroid. So these things are very important. Foods which hurt or heal the thyroid. So there are specific vitamins that are very important for thyroid health. Vitamin D, for example, iodine. And remember, we need that Goldilocks zone. Too much iodine can also be a problem. In fact, and especially when it comes to hyperthyroidism, we have to sometimes avoid iodine. We have to be very careful. We don't want to stimulate the thyroid too much with too much iodine. So it's very important to take a personalized approach and work with your doctor and your homeopath and find out which is going to be the right levels for you. There is kind of, the verdict isn't out yet about iodine and people with Hashimoto's. So some doctors feel that with those with Hashimoto's, they need to be a little bit more cautious with iodine. Other doctors feel otherwise. So it's good to have that conversation with your doctor and your homeopath. The methylated B vitamins, these help your thyroid and they also help your adrenals. And we talked about the integral relationship with your adrenals and your thyroid. And tyrosine, that's another important vitamin, mineral for your thyroid. And selenium and zinc are essential because they convert T4 to T3. With selenium, the place where you can find most of your selenium, I mean, extremely high doses of selenium is in Brazil nuts. And a good serving size of Brazil nuts is maybe 2 or 3 nuts. You have to be very careful, however, about overdoing it. It's easy to eat a whole bag of Brazil nuts, but you can actually develop selenium toxicity if you eat too much. Honestly, I've had patients just eat 6 or 7 a day and actually raise their selenium levels to toxic levels. So these are trace minerals. We really just need a little bit, but selenium, Brazil nuts will give you all the selenium you need. Vitamin A, zinc, and exercise are important to improve your cellular response to your thyroid hormone. So that's another factor. So it's not just do you have enough thyroid hormone circulating in your blood. Are they binding correctly? Are they transported into the cell? Are your cells responding to them? There's so many different factors when we look at thyroid health that we need to consider. And the beautiful thing again is when you find the right homeopathic remedy, everything attains balance and homeostasis, and you don't have to worry about all these separate parts. But I like to have an understanding of them. So what are some iodine sources? So we have a lot of, we have a lot of seaweed iodine sources. Some taste better than others. Like my family, we love those seaweed snacks that you eat. Be very careful about the oil that they use. I'm not a huge fan of canola oil or sunflower oil. So look at the oil that they use. Dulse is very good and very detoxifying, but not everybody can palate it. It's quite a strong flavor. And then it's always important to know where the iodine or the seaweed is sourced. I know just a few months ago, Japan had a problem with their nuclear site, the radioactivity, that there was too much of a buildup of radioactivity, and they had to release a large amount of radioactivity into the water just because they couldn't contain it. And that's a decision that they made. But then all around, that seaweed from Japan is growing in that radioactive water. So you just have to be careful, know your sources, get it from a good source. In general, it is safer to obtain iodine from food sources. If you're not working with a doctor helping you to supplement, you should always supplement under medical supervision because you can actually get too much iodine. Iodine is a halogen, it's unstable, and you need to have that right amount, just the right amount. Too much is not good. So unless you're able to check your levels and work with a doctor to help you, it's better to get it from food sources, but you should know your source. That's the problem with polluting our oceans and all the rest. It's hard to get good, clean sources. Coconut oil. Many of my patients find that coconut oil can be really helpful for their thyroid. However, if you have the patients that have a specific genotype, which is the APOE4 genotype, and this is something that you can test for, you can ask your doctor for APOE4 genetic test. For these types of patients, they do not break down saturated fats very well. And then they build up in the arteries. And these are the group of patients that saturated fats are not good. Too much saturated fats are not good for, and have to make sure they're eating it in moderation. So it's good to know that if you APOE4 positive or negative, and what your genetic testing shows. Also, some people, I find that people who have ancestry, who and the ancestors never would have come across a coconut tree. You know, some people from European descent or so forth tend to not do as well with like large quantities of coconut products as those where coconuts were growing, you know, where their ancestry is from. And I think we've gone a little bit crazy with the coconut phase, like everybody's coconut and everything these days. It is a better oil, but again, it really depends on your individualized type and your genetics and so much more. So that's something to consider. When we're looking at how to boost our metabolism from an Ayurvedic perspective, they recommend spices that can be medicinal, improving circulation and stimulating metabolism. So these are all the warming spices. And this is for hypothyroidism, for hypo. So cayenne pepper, ginger, turmeric, clove, cinnamon, star aniseed, and black cardamom. These are all beautifully warming and help to invigorate the metabolism. However, if you're also going through menopause and experiencing hot flushes, or if you're someone who has a lot of irritability or heat or skin rashes, then you should avoid this, because if you start eating tons of ginger, you're going to be having hot flushes like crazy. So these are very heating in the system. They're good for people who cold, but if you have too much heat in the terms of actual temperature heat, or a lot of inflammation, or irritability or anger issues, then you need to have more cooling spices. Foods to avoid. So many of my patients find that if they're sensitive to gluten especially, gluten can have a detrimental effect on the thyroid, so something to avoid. Soy for some people, especially if it's genetically modified, not organic. Some people tolerate fermented soy better, so like miso, natto, tempeh, tamari. Tofu is not fermented. So some people can have the fermented soy in small quantities. There were a couple of studies that looked at raw cruciferous vegetables like kale, cabbage, Brussels sprouts, and they found that in large quantities, in the raw form, these foods may inhibit thyroid function. Now, I think out of this list, this is probably the most minor on the list. Also, it really had that effect when people had them in extremely large amounts. And in order to get that large amount, they really had to be juicing them often. So eating lots of raw, juiced cruciferous vegetables. The moment you lightly steam it, that goitrogenic effect goes away. So I would say that there are so many advantages in these beautiful vegetables that you always have to look at it from a personalized perspective. If there's any history of breast cancer in your family, or if someone has HPV, or if you need some indole-3 carbonyl, if you're estrogen dominant, then you have to look at the benefits of these vegetables versus maybe the tiny risks that it may have on your thyroid gland. So you can always test this out, you know, have a few weeks where you're juicing these every day, check your thyroid function, see if it makes a difference. These are such good vegetables for you. I don't really like to take them away, especially if there are other things going on, but something to be aware if you're having extremely large quantities, and again, only in their raw form. The moment they are lightly steamed or cooked or sauteed in any way, that goitrogenic property seems to be reduced. One thing to bear in mind is that if you are going to get your thyroid test, it's good to avoid biotin, which is B7, for at least 2 days prior to testing, because this can actually interfere with the thyroid test and create inaccuracies. So if you are taking any biotin, avoid it 2 days before your thyroid test. So what are the treatment options for people with thyroid conditions, especially hypothyroidism? So you could do hormone replacement therapy, either conventional thyroid hormone, or you could take bioidentical, the natural thyroid hormones. When we look at that, there are risks involved. One of the risks that are commonly found in people on thyroid hormones is there's a risk of bone density. It can actually lead to osteopenia, osteoporosis. Now, the bioidentical are significantly safer than the conventional. And even the bioidentical, there are different brands and different forms. Some are gluten-free, some are purer than others. So, you can't necessarily lump them all together. But there are always going to be some risks. Sometimes the risks are worth it. And I say to patients, go ahead, you're doing so much better. Just continue with your bioidentical thyroid hormone. It's not a big deal. And we'll continue to treat you homeopathically. But for some patients, they want to use other means. And you can do herbs, supplements. And then lastly, and I think so beautifully, homeopathy can be extremely helpful in treating. So what about coming off thyroid medication? It's very important to never just stop your thyroid medication. This can be very dangerous. You have to do it in collaboration with your doctor and your homeopath, and there are weaning off guidelines for safety. And the goal isn't necessarily to come off thyroid medication completely. It's a success if you can reduce the amount that you're taking. So that should never be the end goal, to come off your thyroid medication. The end goal is to make you feel better, healthier, and so forth. And if you're able to come off your thyroid medication, that's wonderful and an additional plus. What about hyperthyroidism? So this is an overactive thyroid. And this you can see is much fewer incident. It's only 1.3% of the population. Again, higher in women. Graves' disease is the most common in 6 to 8% of cases. And I've seen Graves' disease come on after a viral infection. I've had a couple of patients have Graves' disease that developed after vaccine reactions. So there's different reasons why. It's an autoimmune reaction, but it's much less common than hypothyroidism. However, hyperthyroidism can be much more serious. In fact, the biggest, I remember when I was working in the hospitals in South Africa, we saw a young girl come in with hyperthyroidism. Her eyes were, she was like the classic example. You could not miss it, even just walking right past you. She was agitated, she was skinny, her eyes were like bulging. She had that exophthalmos that you can see in the picture. She was hot and she couldn't sleep. But what was the most dangerous, it was her heart rate. Her heart rate was so high. This can really be quite dangerous. So we have to get it under control fairly quickly to stabilize the patient. They feel irritability, jittery, as if they've been drinking too much coffee, similar to that coffee state. So what are the causes? The most common is Graves' disease. That's an autoimmune reaction. Medications. Oh, this is the most common cause that I see, is patients who are hypothyroidism and they're taking too much thyroid medication. This I see very, very often, or too many supplements that stimulate the thyroid. And we should expect that if they're on thyroid medication, whether it be a synthetic or natural, over time with homeopathic treatment, there is a chance that the medication will become too strong and they can go into a hyperthyroid state. So it's very important for them to check their thyroid regularly to make sure that this is not the case for them. Certain viruses, thyroid nodules. So our bodies produce thyroid nodules or if the thyroid is not working properly. And sometimes these thyroid nodules can get a little too excited about producing thyroid hormones and produce too much. And then thyroiditis, which is an inflammation of the thyroid. So what foods to eat in a state of hyperthyroidism? Well, in Ayurvedic medicine, we want to cool them down. Their metabolism's too fast. We want to have cooling foods and herbs, avoid warming foods, avoid foods rich in iodine, and instead have things like cucumber, mint, cilantro, parsley, and so forth. These will cool the system down. They're not going to treat the underlying hyperthyroidism, but they'll help with the symptoms. So this is what a thyroid nodule looks like. It's more common in women than in men. And one of the reasons that's been hypothesized why thyroid conditions are more common in women is, so the thyroid is where? It's in our throat chakra. And in general, women kind of repress their emotions more in this area. They tend to kind of hold things in, not express themselves, not express their needs, not express their boundaries. So the energy gets stuck here, and that can cause imbalance in the thyroid. And that's one of the, so I remember a doctor hypothesizing that's why it's more common in women. So clinical studies showing effectivity for homeopathy for thyroid disease. There's actually a lot of studies showing that it's helpful. This is a really nice thing to have. If you've been practicing homeopathy for a while, when patients call in, they'll say, well, have you treated this before? And you can tell them about, how many cases you've treated or so forth. But if you are new to homeopathy, if you're a beginner, you don't really have any of those cases to talk of. And so you can say to your patients, well, I haven't personally treated this before, but there are clinical studies showing how effective homeopathy is. And this will help the patients gain trust in you. So you can always talk about clinical studies, how it is shown to be effective. And I actually utilize these studies very often. I may not utilize the remedies that they use, but I may look at their methodology. The potency they use, the posology, how often they gave it, and so forth, the cycles. That can actually be very, very helpful, even if you're not using the exactly same remedies. So I love this because this was quite a large study. There's 194 school children with subclinical hypothyroidism. It was randomized, placebo-controlled, single-blind trial using individualized homeopathic remedies. So it's beautifully individualized. And in the homeopathic group, they saw a 86.94 decrease in TSH. So the placebo group still had a reduction, which was really interesting. But we saw a marked reduction in the thyroid antibodies in the homeopathic group compared to the placebo group. So yes, we can not only help with the thyroid hormones, we can also help with the antibodies as well. This is a study in patients with ovarian cyst, epididymitis, and hyperthyroidism. So as I mentioned, hyperthyroidism can be very dangerous. And this was 23 out of 25 patients experienced improvement with homeopathy. So this is actually a nice study because it shows a complication of thyroid disease. So when the thyroid disease has actually gotten severe enough to the point that it actually caused orbitopathy. And so they used a combination of kinesiology and homeopathy, and a study showed the involvement of lymphatic structures and flow in the pathogenesis of TAO, which was really encouraging to see. So even in advanced cases, the homeopathy can still help. There's another study done on homeopathic treatment of subclinical hypothyroidism, and it was successful. Treatment was successful in 68% of patients with serum TSH levels back within the normal range. So you can actually see the difference on the blood tests as well. So these are observable results in the patient, but we can also see results in the labs, which is beautiful. Okay, let's talk about homeopathic remedies for the thyroid. Let's get to the real specifics. Okay, so there are many, many different remedies that can help the thyroid and support the thyroid, literally hundreds. It's really important to find the right remedy, to find the simillimum. Homeopathy is precision medicine. You have to look at the whole case. You can't just look at one or two symptoms. You have to look at the whole person. And it's very specific. And it's important to find the best match for successful treatment. So I'm going to talk about a few remedies. These are merely examples, but there are many, many remedies that I will not be covering today. And it's important to find the right one. And treatment for thyroid conditions can be quite complicated, and thyroid medication may need to be adjusted. So it's very important to work with a professional homeopath together with your doctor in treating thyroid conditions. And so the first remedy we're going to take a look at is Calcarea carbonica. This is a beautiful remedy made from the inner layer of the oyster shell. It's calcium carbonate. And calcaria carbonica patients often have that classic presentation of hypothyroid. They cold, they clammy, they put on weight easily, have difficulty losing weight. They have, of course, stamina, they feel tired, often have constipation without urging. They perspire easily, especially from the head and neck during sleep. They have a lot of anxiety and fears, specifically that something terrible will happen to them or their family. They're very conscientious and they tend to get overwhelmed easily. They overwork and they can overwork themselves to exhaustion. They can often have some cognitive symptoms, difficulty concentrating, forgetful. They have heavy periods that seem to go on forever. Their nails can get brittle and break easily. They can have dry, cracked skin. They often have a goiter or an enlarged thyroid, and they tend to have enlarged glands in general. This is a beautiful remedy for hypothyroidism in children, especially if it's affecting their development. So we see delayed development or stunted growth in children. We can even see, I even treated a patient who was pregnant and she had a thyroid condition during her pregnancy and her baby wasn't growing in the womb. And the doctor actually, I think it was like within the 1 or 2 percentile, the doctor said, I don't think this baby is going to be viable. And we gave her calcarb, and not only did it help her thyroid, but the baby actually started growing and was a perfectly healthy birth weight at birth. They can have Hashimoto's with joint pain, arthritis. So yes, the remedy is helping the baby while it's in utero. I had a patient and she developed Hashimoto's thyroiditis after having a grief. She was driving a car and she hit a cyclist, and the cyclist actually ended up getting killed. And it was an accident, but she had so much grief, of course, and so much guilt. And as a result of that, her thyroid just shut down completely. And she developed Hashimoto's thyroiditis, and it affected every single cell in her body. It was more than the shock. It was the grief and the guilt and just that she had done this terrible thing. And I ended up giving her nat mur, and we were able to heal her thyroid back to health and normalize her levels. So nat mur is a beautiful remedy for either hypo or hyperthyroidism, Hashimoto's thyroiditis. They can have a goiter or swelling of the thyroid conditions that come on from grief. And we see very often, especially in women, that if women have a breakup or a disappointed love or a divorce, they tend to put on weight. And this weight is a way to protect themselves from future hurts. If I'm overweight, then no one can come close to me and I will never be vulnerable and I won't get hurt again, is the kind of feeling. So what happens is the grief and the pain of that grief actually slows down their thyroid. But then they come and say, why can't I lose weight? I'm struggling to lose weight. And it's not only the thyroid that we need to heal, we need to heal the grief as well. And the Natrum muriaticum is a beautiful grief remedy. They tend to hold their emotions inside. They tend to dwell on past events, so often grieving over something that happened a very long time ago. They can be very reserved, and they don't like consolation. They don't want other people to feel pity for them. They don't want other people to feel sorry for them. They don't want other people to see them cry. They kind of prefer to be alone with their grief. It doesn't make them feel better to be consoled. That doesn't really help them. It just makes them feel worse, actually. That makes them feel awful. It makes them feel vulnerable. They don't want to, open up. If you're going to a funeral, the Natrum muriaticums will all wear sunglasses, so you can't see them crying. They don't like other people to see their vulnerability. They're very stoic. They tend to crave salt. And iodized salt is not what they need. They need the right form of iodine if that's what they need. And they need the remedy, nat mur, not the salt. They tend to be constipated. They can't urinate in public places because it's too vulnerable. For them, this is a very common cause of hypothyroidism resulting in infertility. They get headaches, worse with the sun, and they have the classic symptom of feeling better or worse by the ocean. Okay, next remedy is sepia succus, the ink from the cuttlefish. You probably have seen this ink in sepia photography, that kind of that brown, not the black and white, it's more like brown hues. That's made from this remedy. So this is a good remedy for hypothyroidism. And how the thyroid symptoms present mostly is just sheer exhaustion. And when they're exhausted, they are depressed, they indifferent, they irritable, so irritable. They especially irritable with their husband or their children. And their irritability is because they're exhausted. All they want to do is sleep, and they just kind of become so indifferent to their loved ones. They have no libido. They don't want to be touched. They definitely don't want to be touched sexually. They have no energy for that. That's the last thing they want to do. But if they can muster up the energy, they actually do feel better with exercise. This is very often the hypothyroidism may come on during some kind of hormonal changes, whether it be pregnancy, postpartum, during menopause. This is when a sepia's hypothyroidism often comes on. And the hypothyroidism can be a cause for infertility or miscarriages. So when you're treating a patient who's having recurrent miscarriages or infertility, it's very important to assess their thyroid function. They can have Hashimoto's with joint pain or arthritis. They have constipation, hair loss. It's a very hormonal remedy, like all the hormonal symptoms. The next remedy is iodum curum, made from iodine. Now, there are some homeopaths that give this for hypothyroidism, but the classic symptoms actually show more of a picture of hyperthyroidism, an overactive thyroid. So there's a lot of excitability of the nervous system. They are hurried, rapid, talkative, irritable. Their heart is pounding. A lot of anxiety that's better for eating. It feels a little bit like low blood sugar. They just are ravenous. They are ravenous, and they just need food right away, instantly, and they continue to lose weight. Their thyroid their metabolism is that fast. They cannot get enough food in them. They are hot, they're sensitive to heat, and they often have enlarged glands. This is probably the most commonly used remedy for a hyperthyroidism state, but there are others, so it always has to be just the right one. Calicarbonicum, this is potassium carbonate. These are very chilly patient, and they're worse for any kind of cold, drafts, uncovering, very sensitive to the cold. They tend to put on weight, but it's more than just weight. They tend to swell. It's more like edema. It's more swelling, water retention. And they swell in particular areas. They especially swell in the face, but especially they get these bag-like swelling of the upper lid, especially right in the inner corner. So the medial aspect of the eye, you can see from the picture, they get this bag-like swelling. This is a classic symptom of both calicarbonicum and also this swelling around the eyes. This periorbital edema is very common in hypothyroidism. They get hair loss at the temples, and they lose the portion of the eyebrows. And hypothyroidism, they tend to lose this lateral 1/3. So if we divide the eyebrow into thirds, they tend to lose the lateral, the outer third of the eyebrow tends to fall out. And by the way, it's so interesting. If you have a patient who loses their eyebrows from hypothyroidism, they will grow back when the remedy starts working. It's amazing. They'll grow back these beautiful eyebrows. So that is something that will return. Weakness and fatigue from responsibilities. They're very kind of upright, rigid, strong sense of responsibility, but that causes a lot of weakness and fatigue. They have constipation, especially around the periods with hemorrhoids. Oh, this is classic. They have these lower back pains that drive them out of bed at night. It's so painful to lay in bed. In fact, when I was pregnant, I had this. I had a bad chiropractic adjustment during my pregnancy, and I got injured. And I went to have so much PT, nothing helped. And calicarbonicum, oh my gosh, I couldn't sleep at night. And this remedy saved me when I was pregnant. It healed my back because I could not lay in bed at 2 to 4 a.m. It would I feel the pain, I'll wake up and have to get out of bed. It's a great remedy for right-sided sciatica. They have joint pain worse for cold damp, waking at 2 to 4 a.m. They can be irritable, argumentative, and very easily startled. Everything startles them, noise, touch, easily startled. It's a great remedy to calm down their nervous system. This is the Calicarbonicum facies, which is almost exactly the same as a hypothyroid facies, the dry hair, coarse, sparse, the lateral thinning of the eyebrows, the periorbital edema, and the face is puffy with dry skin. Look at this patient here. This is on the left, you'll see pre-treatment and post-treatment. You can see the change in her face as she moves from a state of hypothyroidism to normal thyroid, we call that euthyroid. Just from treatment, how her whole face changes. She didn't get a facelift, she didn't get Botox, she just had a thyroid treated. It's pretty amazing. Next remedy we're going to talk about is graphites. This is plumbago, made from plumbago. Very similar to our other carbon remedies. Our other carbon remedies are calcarb or calicarb. They tend to be overweight, chilly, worse for cold drafts, hair loss, especially at the temples, just like calicarb. The exophthalmos, we see that. We see goiter and thyroid nodules. In fact, they have a symptom of choking from the goiter. Some people feel this like lump in their throat all the time. That can be thyroid, that lump in the throat sensation, especially worse for empty swallowing. Now, graphitis is a very skin predominant remedy. So we see a lot of skin symptoms on this remedy. The skin becomes dry, thick, callous, cracked, unhealthy. The nails become thick, hard, deformed, and they have a lot of constipation with hard, lumpy stool. This can cause menstrual irregularities. The menses are late or scanty or completely absent, and they can develop infertility. They can have Hashimoto's with joint pain or arthritis. They can be weepy, anxious, or sad, and have a lot of cognitive dysfunction from the thyroid. So difficulty concentrating, thinking, forgetful, indecisive. And as soon as the state is treated, all those symptoms go away. It's a complete transformation. Here we have a remedy, Calcarea iodata. So we've talked about calcarb as a remedy. We've talked about iodine as a remedy. And this is almost like a hybrid remedy with both elements, yet has its own unique, distinct features separated from the others. What's very prominent in this remedy state is like enlarged, hardened glands, lymph nodes. So the thyroid is enlarged and hardened with like small little crypts. This is very important. This is thyroid conditions for children that come on, that originate during puberty. It is a very strong symptom for this remedy. So this is a great remedy for like puberty or changes in hormones. They tend to be overweight, flabby children, prone to catching colds with a weak immune system. They can have profuse perspiration from slight exertion, hair loss, weakness. So all the glands can be affected. Any gland, and they become enlarged and hard. It could be the thyroid gland. There's some maxillary glands, the tonsils, the adenoids. This is a very glandular remedy. And they can have a lot of breast lumps, uterine fibroids. So these are all lumps and glands and cysts. They get headaches from cold wind, and they feel better for fresh air, just like iodine does. The next remedy we're going to be talking about is from sea kelp, the fucus vesiculosus, which is made from sea kelp. With fucus, so we know that sea kelp is rich in iodine. So we're going to know that this is going to be an important remedy for the thyroid. These patients tend to be overweight, with enlarged thyroid, exophthalmos, and a non-toxic goiter. What is a non-toxic goiter? A non-toxic goiter is a swelling of the thyroid that doesn't actually affect the thyroid functioning. So for example, they can have an enlargement of their thyroid, and their thyroid hormone levels can be completely normal. And this can be either due to simple iodine deficiency. So all you do is give them iodine and they feel better. If they can't absorb the iodine, properly, then they may need a remedy like fucus because maybe there's a problem with the absorption. It can also be caused by certain medications. They can have obstinate constipation. The skin of the lower extremities are soft and flabby, and they have a heavy sensation in their stomach, so fucus. And the last remedy I'll be talking about today is thyroidinum. This is a glandular remedy, and it's made from either the thyroid gland of the sheep or the calf. And we use thyroidinum to regulate both hypo or hyperthyroidism depending on the potency that you use. So the French style, of treating using thyroidinum is they would use, for example, a 4C or a 5C to stimulate thyroid function. For example, in hypothyroidism, they may use like a 7C to regulate the thyroid. Some people with, especially those with thyroid nodules, can actually have mixed thyroid. So at times it may be too high or too low. The reason is the thyroid nodules were produced because the thyroid function is too low, so the body produces excess tissue, but at times that thyroid nodule is releasing too much hormones. And then they may use a 9C to inhibit thyroid function, for example, in hyperthyroidism. So thyroidinum, and by the way, it can work very, very well. I've been able to regulate thyroid function with thyroidinum many, many times. However, it doesn't treat the underlying root cause, and it doesn't treat the whole person. So I usually use thyroidinum only as a last resort when I feel like I've found a good homeopathic remedy, but still the thyroid function is not normalizing. So we can often use this either as an adjunctive to a constitutional remedy or when we're just not getting results with well-indicated remedies, and it can be very, very effective. Obviously, those 4Cs, 7Cs that I talked about are very difficult to find these days. So you just work with whatever potencies you have, the closest you can get. But that is the French style of using them. And I believe in Germany, they do that as well. They have more range of lower potencies, and they'll use lower potencies to stimulate, medium potencies, and in places like France and Germany, a 7C is a medium potency to regulate, and a high potency to inhibit. And a high potency in many of the European countries is like a 9C or 15C. We can also use chemotherapy. So chemotherapy is similar to homeopathy in the sense that they are diluted. They're using diluted tinctures of embryonic plant tissues, which is really the buds. So they contain the stem cells. It's almost like a homeopathic version of a sprout. So using those really, really embryonic plant tissues, and it's diluted. And the chemotherapy for both thyroid and adrenal support is Ribos nigrum, Quercus pendulata, and Betulopubescens catkins are the ones that we use for the thyroid. And again, I usually try to find the simoleum first, and I love to have these as tools in my toolbox. If the treatment isn't working, we have other options to try. I want to share a little bit about some of other ways that you can learn from me. On Naturopathic Seeds, you can find my course on NoSo's unique therapy for chronic infections. I also wrote a book called Live Right for Your Remedy Type that I'm extremely passionate about. It's actually the first ever, and I believe the only, homeopathic lifestyle guide. So what it's about is based on your homeopathic remedy type. There are certain diet recommendations, lifestyle, what exercises you should do, which modalities are going to be most effective for you, and even things like relationship and parenting advice based on your individualized homeopathic types, because we're all so different. And why should we all we have so much information about our homeopathic remedy types from an individualistic perspective. So this gives a very, very comprehensive guide to your homeopathic remedy type and how to maximize your homeopathic treatment, and especially when it comes to diet and lifestyle. Infertility Secrets, Struggles, and Successes. This is a book that I co-authored with some other beautiful women on how to treat infertility with homeopathy and other natural therapies. And then on my course of obstetrics and gynecology on Whole Health Now, this is probably the most comprehensive course. It's a part 1 and 2. many hours. I think it's like a 12-week course on everything obstetrics and gynecology based on my work working in a traditional OBGYN clinic for over a decade. And, I have a lot of experience treating all kinds of obstetrics and gynecological conditions and women's health conditions. So I hope that you enjoy this work. I also would like to give a shout out about the film introducing homeopathy that's coming out. It's amazing. I was part of the film, so I got to see some sneak previews of it. Hasn't come out yet, but it will be premiering at the Joint Annual Homeopathic Conference and will hopefully be available on Netflix. I highly, highly recommend this for yourself to see. And it's also a beautiful way of introducing other people to homeopathy. The stories are so compelling. It is amazing, just following the characters and the journey they went through. It is heartwarming. It is beautiful. I really think will change many people's minds and opinions and make them open to homeopathy for those that are not open. So a beautiful way to introduce others to homeopathy. Everybody needs to see this film. So I hope you get to watch it. It's just really well done. Quite brilliant, actually. Thank you so much for your time. I hope I get to teach you to you all in the future. And my website is San Diego Homeopathy, and you can learn more about my books and webinars on homeopathicbook.com. Thank you. Goodbye.